I want to talk a little bit about BCI is a big field. There are a lot of emerging companies. Where we see ourselves in the ecosystem is that there are currently 2 companies that are building neural recording at scale. High data rate brain-computer interfaces that can talk to a lot of individual neurons in a completely wireless way. And that's Paradromics and Neuralink. There's a big difference between our 2 companies. One, for those of you who don't know, I'm not a billionaire, and so I've had to be a little bit scrappier in my approach. But also, I fundamentally think that the use case for BCI over the next 20 years is medical. And if you talk to patients who are looking for therapies, they're looking for durable therapies. They want implants that will last more than 10 years. Elon sees the future of BCI being in consumer devices, and Neuralink has admittedly built devices that have a lifetime expectancy less than 5 years and a reliable lifetime of maybe 2 to 3 years. They're using polymer threads that don't last very long. They're using non-hermetic encapsulation. We went in the completely opposite direction. We're using platinum-iridium wires that will be there 20 years later. We're using hermetic encapsulation for all of our active electronics. We're building this as a 10-year device. And you might say, like, okay, well, if you're that constrained, if you're taking on additional constraints in your design, maybe it suffers some way. Perhaps like the data rate's going to suffer. But that is definitely not the case. Right now, we are benchmarking our devices preclinically at 200 bits per second. That is a world record for implantable BCI and is 20x the data rates that you'll see reported either in the BrainGate literature using the Utah array or in Neuralink's preclinical or clinical data. So we are building a best-in-class device both with respect to data transfer in and out of the brain and longevity. We now have animals that were implanted over 3 years ago where the signal-to-noise ratio for these single neuron signals we're measuring hasn't changed over 3 years. That's unprecedented in this kind of neural recording, and I'm really excited to bring the device into our first-in-human clinical trial. We've done some intraoperative work in humans in May at the University of Michigan. We're expecting IDE approval by the end of the year, and our clinical trial for restoring speech will start likely beginning of next year.